What you're about to see is a health broadcast. This series of programs is dedicated to alternative therapies complementing modern medicine, the men and women who practice it, and the people they benefit. You may now place a blank tape in your VCR. This information could be beneficial to the health of you and your loved ones. If we are smart enough to know that stress kills, shouldn't we be smart enough to diffuse it?
I'm Linda Maricini. Welcome to our show. Today's show on stress will deal with the components of stress that are affected by psychosomatics and how we can empower ourselves against these. Our guests today include, to my right, Jody Rose Staley, a certified holistic practitioner, psychic medium, shamanic minister, in private practice. To my left, Miguel Cisneros, a practitioner working with aromatherapy. And to Miguel's left is Dr. Diane Baker, a psychotherapist in private practice with specialties in attention deficit disorder, family crisis relations, and stress management. Thank you for being here.
Thank you.
My pleasure. Psychosomatics connotes something very negative to many people. Literally, when we say the word psychosomatic, it means that something in the mind is influencing something in the body. But people who we say are psychosomatic have an association that suggests weakness, when in fact this is a literal term, and we are going to talk about this to use it to our advantage, to talk about psychosomatics in a manner of empowerment. There are many self-destructive components of psychosomatic illness, for example, and the important thing is to recognize our behaviors, the behaviors leading to these types of psychosomatic problems, and then change that, turn that around. Jody, would you like to comment on that for me?
Well, I think that from my perspective, looking at the psychosomatic aspect of our human nature, we need to know that there are areas that we need to move beyond fear, because there's a lot of what's happening inside of ourselves that are affected by what's non-physical. And I sense that in looking at the different ailments, in looking at people's issues that deal with such a matter, we need to go beyond and to feel safe and to step into aspects of who we are to really get to what is creating this type of behavior and what creates this type of illness within us from a perspective that's from beyond the physical. And so where I work with psychosomatic is really dealing with non-ordinary reality and what's creating it, what is really affecting the thought pattern, and you know, that individual, how are they choosing to manifest these issues or these symptoms in their life.
Diane, if you could comment on how a patient or client presents to you with regard to illness that may be psychosomatic, then we can go from there.
I'd like to talk a little bit about the emotional state that they bring when they do come to me. With the tension and the anxiety, the stress is created. They're emotionally out of balance. And I don't think that a lot of times they're aware of what this emotional state does to them physiologically. So when we look at how powerful the mind is in influencing the body functions, we're able to help them look at getting into a better equilibrium or a calmer emotional state. So as a therapist, it's always my pleasure to be able to discuss all of this with them, letting them know exactly how much power they have on themselves. And it isn't really so much the power on the outside, it's really the power from within. So it's really interesting when you're able to help them connect the mind and the body working as one. And I don't think we often think of that. So I think it's real important that we keep that in mind.
Many times we have a patient or client that comes in totally out of control. Other times the patient will bring themselves in and has recognized that they have really lost what they perceive as their control. it can be chemically related. In many cases, we like to tell the patients, and it's really true, it is not their fault. When anxiety and stress get to a certain point, we have depletion of certain brain hormones. One of the main hormones is serotonin. It is a chemical that is in the brain but also has receptors in many other areas in the body. It has a lot to do with mediating pain. It has a lot to do with sleep disorders. And that chemical from drip torture or post-traumatic stress disorder or just a burnout syndrome can certainly get depleted. We know that this chemical, for example, in primates, when it is depressed, when there is not enough of the chemical in primates, they become more aggressive. They lose their social behaviors, such as grooming in monkeys and animals of that sort. So there's some very chemical neuroendocrinologic things that occur. Hopefully, we would like to teach people to address this problem before it gets that far, to recognize it in themselves, and then take charge and empower them.
Linda, that's a real good aspect, because when they come in and their thinking is so, as I call it, gray, they're really not able to make good decisions for themselves, and without being able to refer them out to a medical doctor or psychiatrist, being able to evaluate them for medication, making sure that we differentiate between, is this a long-term depression, is this a reactive depression, what are we really dealing with? And then when we explain to them that, of course they're not making good decisions, that they're not going to be able to. I think a lot of people taking medicine as somehow I'm weak and I don't want to do this, I want to try it without. But if you had a broken leg and you wanted to do something, you'd use crutches. So I think it's another tool that we need to use to our advantage and recognize how severe depression can be and how it changes the functioning of our clients.
Miguel, go ahead and give us your input, and then we'll...
Well, it's not only in my practice, but in all practices in healthcare. I mean, we definitely understand that the ability of the person to get involved with their healing is definitely the top medicine. That, you know, there's definitely results on those who get involved with their healing and those who don't, and it has an effect on their health. I practice aromatherapy, which is through the olfactory system, and one of the levels that this works is actually for the ability for them to get involved in actually their healing. If they don't, then we have a harder time to get involved with some type of care. And definitely has an effect the way we view things.
Jody, I know you brought a tape to show us.
Yes, actually this was on location at Dr. Baker's center, Kendall Counseling Center, and we're going to be looking at some alternative therapies, specifically biofeedback.
Let's take a look at it.
I'm Jody Rose Staley, and today I'm on location at Kendall Counseling Center, the offices of Diane Baker, psychotherapist, and we are participating in a demonstration with Tracy Baker-Cope, who is a stress management consultant, and Tracy will be demonstrating along with her patient, Sonia, biofeedback. So Tracy, would you like to describe for us what biofeedback is?
It's showing the physiological changes that stress and anxiety and stuff brings on your body, and it's self-monitoring, and I really don't do anything. The patient is their own coach, and they figure out how to self-monitor the changes in their body.